Well, hello everyone. Welcome back to another edition of MRTC Talks. My name is Paul, one of the counselors here. Today's topic, how to find the right counselor. One of the most important and I think helpful things that you could do as part of your aftercare plan from MRTC is to work regularly with a drug and alcohol counselor. Obviously, a counselor is someone that is professionally trained and often has years, sometimes decades of experience in the area of addiction, in the area of recovery, and can be one of the most valuable parts of your support system. Different from a sponsor, different from your friends, different from your family, but someone that is professionally trained, experienced, and helps you from a unique vantage point to be able to navigate some of the ups and downs of early recovery. And if you have been benefited by your work with a counselor at MRTC in any respect, I hope that you will strongly consider working with a good drug and alcohol counselor after you leave here. I can scarcely recommend anything that could give your chances for recovery a better shot in the arm. But I think in order to be able to do that, you got to be able to do two things. Number one is you got to be able to find a drug and alcohol counselor. And number two, even after you find that counselor, you have to make sure that that counselor is the right one for you. In other words, that there is a fit or a match between you and the particular counselor. And so what I'd like to do in this brief video is just talk with you a little bit about each of those two things. How it is that you might be able to find a drug and alcohol counselor in the first place after you leave MRTC. And second, once you get to a counselor, how to make sure that that person is the right counselor. And what happens if the counselor that you start working with doesn't turn out to be the right fit or the right match for you. All right, those two things. Let's start first of all with the issue of how to find the right drug and alcohol counselor. And by the way, there are many different types of counselors. There are mental health counselors, for example, that deal with mental health related issues like depression, anxiety, trauma. There are obviously psychologists who deal with kind of more mental illness related issues. There are psychiatrists who are medical doctors who don't provide counseling or therapy, but do provide typically medication management, if that can be something that's helpful. But there's also drug and alcohol counselors, and those are obviously people like the counselors who work at MRTC that are specifically trained and experienced in the area of addiction. And even though many of these counselors could be of benefit to you in your recovery and your life, one of the places that we would recommend that you start is with a good drug and alcohol counselor. Both because that is one of the primary issues that you are dealing with, and that if you want to deal with any other issue in your life, like depression, like anxiety, like trauma, obviously it's going to be important for you to be able to stay sober. If you are numbing yourself out constantly through substances, you won't be able to make much headway in dealing with any of those other issues. In addition, if you get hooked up with a good drug and alcohol counselor, they can help you to navigate the system and help you to get into the hands of any other type of therapist that could be beneficial for you in your recovery. So the first place to start, in my opinion, is with a good drug and alcohol counselor. So how do you find one of those? And again, we're talking about a counselor that you might see, ideally, once a week for an hour in their office. In which you could talk about how things are going for you in your recovery, and they may be able to support you and help you in being able to navigate some of the challenges that you are likely to face as you start your journey as a newly sober person. All right, so where do you find a drug and alcohol counselor in the first place? Well, we are very lucky being in BC because the BC provincial government has funded drug and alcohol counselors for all of its residents. Virtually every community, certainly every community in the lower mainland of any size, has a clinic located in it that provide free drug and alcohol counseling for residents of that particular area. Here in the Fraser Health catchment area, certain communities like Surrey have clinics that are directly operated by Fraser Health Authority that provide drug and alcohol counseling for residents of Surrey. Other communities like Maple Ridge, for example, have agencies that are private agencies. In the case of Maple Ridge, it's Alouette Addictions, that then contracts with Fraser Health to provide drug and alcohol counseling to residents of Maple Ridge. But in every community, there is a clinic that provides free drug and alcohol counseling to residents of that particular community. And all you have to do is to go to that particular clinic and tell them that you'd like to participate in drug and alcohol counseling, and they will help you right with the process necessary to get set up for that. How do you find the clinic in your area? Well, BC has established a centralized number, which is simply this number. It's the BC Drug and Alcohol Counseling Referral Service, 1-800-663-1441. It's 1-800-663-1441. Another high-tech graphic here on MRTC Talks. That is the number that you call, and it's a 24-hour number, and they will, if you tell them that you're interested in getting hooked up with a drug and alcohol counselor, they'll ask you what community you're from and help you to direct you to the clinic in your area where you can call them for information or drop by to be able to get set up. So that is the first step, finding a drug and alcohol, a drug and alcohol counselor. But in many ways, an equally important step is to find the right counselor. And what I mean by that is that what research shows is that a person in counseling is most likely to make progress and have success when they are with someone that they feel is a personal match to them, a personal fit to them. And not every counselor is going to be a match or a fit for every particular client. If you even reflect, for example, on your experience at MRTC, my guess is that, right, as you think about the counselors at MRTC, there are certain ones that seem to resonate with you. Certain ones that seem to kind of fit with you, are a match for you. You like the way they think, or the way they talk, or the way they interact with you. And others may not seem to be as much of a match or a fit with you. It is a highly personal and subjective determination, but it is critical for you to get with someone that you feel is truly a match for you, and that may or may not be the first person that you are assigned to. And so what I want to do is to give you a kind of a two-part process for how you might discern whether a particular counselor is a good fit for you. And this process consists of two sets of questions. One, which would be a set of questions that you ask the counselor, him or herself, in your first session with them to find out more about them, their background, their training, their experience, their approach, their track record, so that you can use that information both in terms of the substance of what they say, but also how they say it, because part of finding the right counselor, part of it's science and part of it's art. It's just having a feeling and trusting your gut instinct as you listen to the counselor talk, is this someone that you feel could be of benefit to you? So the first part of the process is a set of questions that you would ask the counselor in your first session. And then the second is a set of questions that you would ask yourself after you've had a number of sessions with the counselor to try to help you to see whether you feel that things are on track and that this person truly is a fit or a match to you. If you're watching this in group, or even if not, perhaps your counselor would have given you, right, a document called How to Find the Right Counselor, and it contains these questions that I've talked about. And so I'd like to just kind of briefly go through all of them with you and explain a few of them, just so you have a little bit of a sense of what you might ask the counselor and yourself. The first set of questions, again, is that you would ask the counselor in your first session. And what I'm suggesting is that you, in essence, interview the counselor, and that you be an informed consumer of counseling services, and that you find out a little bit about the experience and background of the counselor that you're dealing with to kind of get a sense about whether they might be a match for you. So take a look at some of these questions. They're all pretty straightforward, but I think if you ask them, they may give you some valuable information. The first question is, how long have you been a counselor? Now, that is not necessarily dispositive. There are some counselors that just have a few years of experience that may be extremely skilled and extremely knowledgeable, and others that may have practiced for 25 years that may not be as good a fit for you. But I think just getting a sense about, is this a newly minted counselor? Have they been practicing in the field for a substantial number of years? That's one data point that you might use to determine whether or not this person is a fit. The next question, what is your professional training and experience? So here what I think you're looking to see is, do they have specialized training in addictions? Is that something that they had concentrated on or majored in when they were in school? What is their degree? Are they trained at the master's level? Which is certainly something we'd recommend for you. Are they trained at the bachelor's level? Do they have a doctorate? And what kind of experience do they have in working with people with addictions? Have they typically specialized with other types of people and have just come to the addictions field very late in the game? Or do they have a demonstrated record of experience in working with people with substance use issues? That might be a very telling and helpful thing for you to know. Another question that you could ask them is, do you have lived experience in the area of addictions? In other words, have you had your own issues with substance use? Now, once again, different people have different thoughts on this, and I invite you to think about and talk about what your feelings on this topic might be. Some people believe that in order for them to feel helped, truly helped by someone, it is imperative for their therapist to have actual lived experience similar to theirs. In other words, to have themselves had an addiction and have successfully in the process of recovering from that. I guess the idea, obviously, right, is that if they've had that experience themselves, they can understand, they can relate, they can empathize, they've been there. They are speaking not only from professional training and experience, but from their own lived experience. That is a legitimate way to look at things if that is how you do it, but there are other ways as well. And some people, it is not that important that whether they have lived experience in addictions similar to what you might have. And people who believe this believe that if a therapist is truly someone that is empathic, that can put themselves in the place of people with whom they cannot necessarily identify with themselves based on their own experience, if they are truly kind of understanding and knowledgeable about the plight of the human condition, about what pain and hurt and trauma feels like and looks like, even if they haven't dealt with addiction themselves, they can be extremely helpful therapists. That is a personal decision that you'll have to decide for yourselves. And so I invite you to think about that and see where you come out on that part of the equation. But it is a question you could consider asking them to see what they have to say about that. And again, not just what they say, but how they answer it, whether they've thought through this issue. So if they don't have lived experience in addiction, how do they answer that question? Do they simply say no? Or do they say, no, I don't, and I can understand why you might be concerned about that. Let me tell you why I think I can still work with you, even though I don't have any experience in the area of addiction myself. Once again, it's not just what they say, but how they say it that may give you a gut feeling as to whether this is the right therapist that you should invest your time with. The next question that you could ask, which I personally think is an important one, and that is, have you participated in your own therapy, in your own counseling? And many therapists do believe, and many accrediting bodies do believe, that for a person to be a good therapist, it is very, very helpful, and in some cases even essential, for them to have participated in their own therapeutic process themselves, to have learned about themselves, to have sought a greater understanding and insight about themselves, to have worked on their own issues, to have dealt with their own demons, so that they can both help someone in early recovery to address theirs, and also to ensure that their own issues do not unnecessarily come into or complicate or cloud the counseling relationship. That to me is a very helpful question to be able to ask. The next question, what is your approach? How is it that you help clients to get over and deal with drug addiction? I think that question can be useful. Do they work on just whatever issues you want to talk about? Do they have a process that they follow based on some kind of treatment modality? Do they work with you on relapse prevention? Are they focused on issues of your childhood and how that might have affected your desire for drugs in the first place? What is the approach that they take? I think that is an important and realistic question to ask. Next one, how long does it take to see results? I think this can be an interesting question because it forces the therapist to think about what they're doing and when might you begin to see progress. Some forms of therapy, particularly, for example, if the counselor is focused more on understanding maybe some of the childhood roots of addiction, might take a little bit longer, whereas if a person is focused more on the here and now and the struggles in early recovery day to day, they may be able to help you, for example, maybe in a quicker time frame. Neither one is necessarily better than the other. Sometimes dealing with our childhood issues that may have caused us to be attracted to drugs and alcohol in the first place is the most powerful thing we could potentially do. But it's a good idea just to have a sense of what you're talking about there. And the last question, right, is what would your clients say is your greatest strength as a therapist? I think this can be a good question to ask because it helps the therapist to be able to identify, right, based on their own reflection and any feedback that they've heard from their own clients as to what some of their positive qualities are, what some of their strengths are that they could bring to bear in their work with you. Now, all these questions may strike you as somewhat unusual to ask a therapist, but I highly encourage you to do that. You should be, as I said earlier, an informed consumer. You have a right to not only a counselor, but the right counselor. And my hope would be that by asking these questions, the therapist would be impressed with the fact that you're going about this in a careful, thoughtful way. If the therapist, for example, is defensive, if they don't wish to answer these questions, if they're making you feel in any way as though you are wrong for asking them, I would pay particular attention to that. That may or may not be a sign that perhaps this therapist is not the right fit for you. So those are some questions that you could consider asking in your first session, just to get a lay of the land and to see what this person might be about and whether they are somebody that you feel could be a personal fit for you. The second set of questions that you'll see on the handout here are a set of questions that you might ask yourself after you've had a couple of sessions with the therapist, and they are meant to reflect on the extent to which you feel or don't feel that this particular therapist is a match for you. So the first question is, does it seem like the counselor cares? And that is one of the most important determinants of success in a clinical relationship, as straightforward as that sounds. There's an old adage, right? People don't care how much you know until they know how much you care. And the question would be, right, not what's the technical expertise of the therapist, but does it really seem like they give a damn about you? Do they really seem caring and concerned with your well-being, or are they, just to use a phrase, mailing it in? Do you feel cared about first and foremost in your work that you've had with the therapist up to now? The next set of questions, do you feel heard? Is the counselor a good listener? Do they listen to you without interrupting or criticizing or judging? One of the most, someone once said, right, that one of the most fundamental desires that we all have as individuals is the desire to be heard. And so one of the most important things that you could look for in a therapist is whether you are feeling that in your sessions with him or her. Do you feel heard? Or is the therapist doing most of the talking? Are they interrupting you? Are they making it difficult for you to get out what you need to get out? Do you feel heard? That is one of the most important things I think you could pay attention to. The next question, do you feel as though the therapist understands you? Someone once said that the words that we are most looking to hear in our clients as therapists are the words, "you get it." Do you feel that about your counselor? That he or she gets it, gets you, they understand you? That is one of the most powerful parts of a therapeutic relationship, and something that I'd encourage you to pay attention to. The next one, does the counselor accept you and respect you for who you are? Do you feel accepted? Do you feel respected? Or do you feel judged? Do you feel criticized? Do you feel belittled? Do you feel talked down to? Do you feel inferior? These are things to pay attention to in your gut as you contemplate whether a counselor might be a good fit for you. Next question, do you trust the counselor? Do you feel comfortable revealing personal, sensitive, tender, sometimes very painful things to them? Do you feel as though you can trust them, that they are confidential, that they will respect that in you, that they are trustworthy, that they are people that deserve your confiding in them, sometimes about some of the most painful and difficult moments in your life? The next question, do you feel that the counselor challenges you in a supportive way? Does he or she make you think or view things in a different way? I think this is, to me, a very important part of a good counseling relationship, and that is a counselor that, in a supportive, encouraging, gentle way, sometimes, right, might challenge you, sometimes might help you to see things that you haven't seen before, bring things to your attention that you might not be aware of, give you feedback in terms of how you might land on them, help you to connect dots and see connections between things that you might have viewed as being wholly unrelated, helps you to understand yourself. And some of that involves a certain amount of challenging, and again, in a supportive kind of way. Do you think that the counselor does that? And then lastly, especially if you ask yourself these questions after a few sessions, do you feel like you are making progress of any kind? Do you feel like you are learning, that you are developing, that you are growing, that you are seeing things differently? Do you feel like you're making progress? These are all questions that you might ask yourself after a session or two or three that might give you a sense, right, about whether this counselor is truly the right one for you. And again, I want to stress, right, that some of this is art and some of this is science. The science part of it is the answers to these questions, right? In what direction do they kind of lead you? But the art part of it is more trusting your own gut, your own intuition, your own unspoken wisdom as to how you feel about this particular counselor. So these are two sets of questions, one for the counselor in session one and one for yourself after session two or three, that might give you some greater insight in terms of whether this is the right fit for you. Now, the last part I think we have to deal with is what happens, right? Hopefully, when the counselor that you get assigned turns out to be one that you think is a good match for you. But what happens if it isn't? I think you have two strategies really at that point. The first is, if you feel comfortable and understanding it might be a little uncomfortable, is to broach that with the counselor themselves. Is to say, you know, I really appreciate you're willing to help me, but I'm not sure if it's feeling like a match for me. I'm not sure if it's our relationship is feeling like a fit. I'm not feeling as though I'm necessarily benefiting in the way that I know we would both like me to benefit from. And the idea would be to see whether you might be able to make some adjustments to your counseling relationship that in a way that might work for you more effectively. And a good counselor should be very interested in your blunt, unvarnished feedback around how the counseling is proceeding, and on that basis be willing to make adjustments if that can be done. I think once again, if the counselor is defensive about that, if they try to make you feel badly for bringing up concerns that the counseling is not benefiting you in the way that you would have hoped, I would be highly suspect of that. That might be an indication that it is not necessarily a good match. But I think that's something you have to give some thought to as you have that conversation. Ideally, I think that would be the best case strategy, but I think that obviously it can be very difficult when a client is feeling that a counselor may not be a match for them to bring that up to the counselor directly. And so if you feel like that is not, for whatever reason, a workable issue, I would encourage you to go back to the clinic that you're seeing this counselor at and ask to speak to either the supervisor or the intake coordinator and tell them that you're not feeling like it's a match between you and the therapist that they assigned you to, and explore the options that you have for getting assigned to someone else. Hopefully, they will work with you to try to help you again, either to make some adjustments in your existing counseling relationship or get you referred to someone else who might be a better match for you. So, in conclusion, working with a drug and alcohol counselor, someone that is specifically trained in addiction and may have years of helping clients to navigate the ups and downs of early recovery, is one of the most important steps that you could take as part of your aftercare plan. A drug and alcohol counselor is one of the most important parts of your recovery support network. But what is important is not just that you find a drug and alcohol counselor, but the right one. The right one for you, recognizing that the right counselor is different for all of us. A counselor that might be really good for one of your friends may turn out to be not the right match for you, and vice versa. You have to find one that you personally click with, that you resonate with, that you feel, right, is a good match for your personality, your goals, your life. How can you do that? Really in a two-step process. The first is to ask the counselor to interview them in your first session to find out more about them, who they are, where they've been, how they work, what their strengths are, and to consider that information in terms of whether or not they might be a match. And the second is to ask yourself some questions based on your own experience with them after a few sessions about whether you feel heard, understood, respected, whether you can trust them, whether they are challenging you in a supportive way, and whether you feel like you're making progress. And if all systems are good, that's wonderful. Continue down that process. And if you are feeling that it is not a match, to take steps either by talking to the counselor, him or herself, or the clinical supervisor or intake coordinator around the possibility of getting assigned to someone else. I hope this has been helpful for you. I think seeing a counselor on a weekly basis after you leave MRTC, again, is a critical strategy. And again, as I've mentioned, if you've been benefited, right, in any way by any counselor during the time that you've been in MRTC, why would you not want to continue that process in the future? Stick with what's working. Do more of what's working. Continue to work with a counselor who can support you. You may find that turns out to be a game changer in your recovery. Hope that's helpful. See you next time.